All right. Welcome, everyone, to another episode of Back to Basics. If you are watching this, you're either part of our Natural Gut Relief Facebook group or you're watching this on YouTube. And we're so excited to have you here. My name is Dr. Vivian Asamoah. I am an integrative gastroenterologist, board certified in gastroenterology and certified in integrative and functional medicine. And every Thursday night, we have an amazing guest. Someone is going to explain something we never knew, but something that definitely impacts gut health. And tonight is no exception. We are blessed and honored to have Dr. Robin Rose with us. She is the kidney guru. Honestly, guys, I've learned so much from this beautiful lady. And Robin, I want you to introduce yourself. Tell us where you are because you are in paradise, I can tell. Tell us a
Yeah.
little bit about yourself
Thanks.
and let's get started.
All right. Thank you so much. This is really an honor to share this. So I'm sitting in beautiful Molokai, looking across the channel at Maui. I've been here for a dozen years. The simplicity of life is an amazing health promoting way of living.
Mm.
My background is I grew up in New York and New Jersey and quit college and went to India when I was young and worked with a doctor and came back to America. This was a while ago, probably before most people who are listening were born. And I went to nursing school, got my bachelor's degree in nursing, did a family nurse practitioner program, recognized that I really wanted a better skill set as a diagnostician, and went to University of Arizona, went to medical school, was very blessed to have many gifts, but one of them was Andrew Weil,
Mm.
became a friend and colleague and influenced how I proceeded to learn medicine. Because at that time I was actually practicing as a nurse practitioner. In fact, I was an attending for med students. And so I was actually able to learn medicine and weave integrative
Native health.
stuff from
Right.
day one. It was
From day
kind of
one. That's perfect, right? I mean, so many of us actually get into integrated and functional medicine years after having
later.
practiced the conventional way. And
Exactly.
there is a mindset shift, when you start learning and really taking care of patients, it's a completely different and very holistic way to approach things, right? I think there's a lot of misconception about practitioners in functional medicine or integrative health today who test a lot and probably test too much and prescribe a lot of supplements. And I think that that kind of goes back to that conventional and traditional way of practicing medicine that I think we really, really have to change. And as we dive into this conversation with you about chronic kidney disease and leaky gut, which is my favorite topic, I think we'll hear more about how we have to treat organ specific disease in a very holistic way and how
Yeah.
looking at things from a very holistic standpoint, the kidney is not just the kidney. I mean, it affects the brain, it affects the gut, it affects the eyes, it affects the skin, it affects so many things. And so for us
Exactly.
to silo organs like the kidney, it's really difficult for us to be successful in not just in treating disease, but in reversing disease. My training is in internal medicine and then gastroenterology. I know squat about the kidney. I really just expect people to get worse and worse if it's chronic, right? And if it's acute, I'm looking for, were they on antibiotics? Did they take an NSAID? What kind of medication was given? Perhaps there's some maybe immune response, some autoimmunity going on, but there's so much more. And so today I'm so honored to have you here talking about chronic kidney disease and how it affects the rest of the organs. Robin, start by defining, how do we define chronic kidney disease? How does a patient know whether they have it or not?
Well, I'm kind of stepping in this with a little bit of a new paradigm. Conventionally, we use a lab called glomerular filtration rate. You see it on a panel, GFR. Usually it says EGFR because it's an estimated made up number based on age and size and
Mm.
creatinine. But it's useful. It's a useful number because you track it over time. But conventionally, we do a cutoff at GFR greater than 60 is normal. And what I found out in the work that I'm doing is no, it's not normal because basically that's 50% function. And as a sidebar for those who are listening, my passion came because I've had to deal with this myself and was shocked at the lack of understanding help from a series
From
of
your
people.
doctors? Yeah.
And I was basically way for, my GFR was 30 and I was feeling terrible. So I'm looking at, okay, well, what happens from GFR 60 to 90? And I discovered that there's dysbiosis that's unique when
Mm-hmm.
kidney is declining. There's
Mm-hmm.
endothelial, the lining of blood vessels gets damaged. The mitochondria, the little things that make energy, starts
Mm-hmm.
declining, all in stage 2, which is GFR 60 to 90.
Right.
That's like the time to consider it. Okay, well, but conventionally, most doctors will say, that's
We ignore it. So as a patient, you want to look at your labs. You want to
so
look
I
at your
just
urea, your creatinine. When it's a GFR greater than 60, like do they usually when it's greater than 60, that's kind of like the cutoff, right? They just say greater than 60, right?
these
Or
days
less,
it's changing.
right,
Fortunately, how that's
right.
changing. And so you can kind of see. And you can ask and you can figure it out from your numbers. But what I did was I said, wait a minute, what do we think of kidney? Kidney failure.
Mm-hmm.
That's an F word.
Yeah.
I didn't want that. Who wants failure? So I'm like, all right, I want kidney success. So I renamed what I'm doing. After med school, I did a family practice residency through UCSF in Santa Rosa, California. Was blessed to have nutrition education. I did acupuncture in the hospital. We had a homeopathy clinic. I started looking at, I can use this mindset, which is really primary care A plus,
Yeah.
to deal with the emotional body, stresses, toxins. It's hard to change your diet. It's easier when you don't feel as sick. So if we intervene earlier, I call this Renology, the art and clinical science of kidney success.
Kidney
Changes your
success.
lymph,
I love that.
changes your
The
limbic
art of
system. As soon as you
clinical
hear that, it's like,
science.
oh. And
Yeah.
so that changes the whole game because really, even in the nephrology literature, it says, see your primary care doctor if your GFR is greater than 30.
Mm.
Well, that's cool, except that people don't know. I mean, the primary care people really don't know what to do.
What to do
Don't
with that.
worry about it. Here's your statin for your lipids. Here's your high blood pressure. Here's your diabetes medicine. Let's see you in
Yeah.
3 months and recheck labs. Not
Wow.
enough.
Not
Utterly
enough.
useless. What,
Yeah.
doctor, what should I eat? Don't worry about it. Just do your
You'll be
best.
fine. So,
And
what are some of the symptoms that a patient with a GFR sort of between 30 and 60 could experience? They could be relatively
well,
mild. They could be
there's an array. I mean, and they say there isn't any, but I disagree. It's subtle. It may be
subtle.
fatigue. It may be
Yeah,
sleep problems. I'm not
right,
thirsty. I'm not hungry. I'm overwhelmed. My executive function is dysfunctional. My joints hurt. I mean,
right.
tell me as a primary care doctor that I know that's kidney. You don't. It's
You
vague.
don't.
And
Yeah.
yet, okay. Did anybody ask my family history? My mother had kidney issues, which of course got missed, and that was not good for her.
Mm.
And so, it's really a matter of listening and looking at labs. I mean, if you're seeing a creatinine over 1, right there's a good diet conversation. An alkaline body is an amazing gift for
For
anybody, and
for anyone and for
especially
the
with any kind of kidney decline.
right,
It's
right,
easy fix.
right.
And so you see screwy things like, the potassium is not optimal. It's subtle. So
It's
there's a
reasonable.
reason that it's neglected because it's not an easy diagnosis.
Do
You
we
can do it.
have any functional medicine tests? Do we have deeper dive tests that can help someone who has help the physician at least or the patient when the GFR is between, 30 and 60 or less even, right? What kind of
Yeah.
additional testing would you do?
Well, you want to, definite inflammation markers, dead rate and the C-reactive protein, they're helpful. Sometimes they're
Mhm.
normal. Phosphorus is really important. and neglected. Phosphorus is important because it sucks calcium from the bones and puts it in the arteries,
Yeah.
both big ouches. And so FGF23 is a lab that will elevate before the phosphorus. And then
Okay.
again, the thing about phosphorus for kidney disease is if here's the normal range, midline is what's safe. And
Okay.
so you can't really say, oh, it's normal. Well, but
Yeah.
midline 3.5 and above, you're getting cardiovascular injury. Not
Gotcha.
okay. And it's,
Mm.
so that homocysteine is an important one. TMAO, which is
Mm-hmm.
trimethylamine oxidase, a gut related issue. Asthma. Well, these are all cardio insults. And the thing to know is that people generally don't die statistically of kidney disease. They die of cardio disease way before
Cardiovascular.
they get to kidney failure. And
Absolutely.
yet, you were talking about that. I call it defrag. We're here to
Mm-hmm.
defrag the body, this fragmentation. I mean, I actually saw a cardiologist who told me, you don't have kidney disease because you don't have protein in your urine.
Of
Wait a
course.
minute.
That's good to
Wait a
bring
minute.
that up.
Wait a
The
minute.
protein in
Let's
the urine.
get you,
Yeah.
and I don't.
Yeah.
But that doesn't, with a GFR 30 and I don't have proteinuria, honey, you're misguiding me.
Yeah.
He apologized after I sent him articles, but so we're really in a tough bind with this kidney business because it's a major organ, and I think of it as a functional medicine root cause.
Yeah.
I
Absolutely.
jumped to the Swift. This is something I did recently. I've written a book,
She's
which
written
I
a
love
book,
to read.
published a beautiful book, Renology Peptides. Yes.
Peptides. The whole point of this is that there is an array of ways to attend to the whole body. Kidney causes brain issues, brain kidney axis, brain eye axis. One of the first ones I learned about was the kidney gut axis.
The
I was
kidney gut
told
axis, the kidney leaky gut, right?
it's
Intestinal
enormous.
hyperpermeability.
It's a
Dive into
huge
that a little
thing.
bit because it sounds like this is happening relatively early once the kidney is hit, right? Where differences in the gut microbiome in someone who has a GFR between 60 and greater than 60 and someone who has a GFR less than 60. So quite significant differences. Tell us a little bit about what we notice, what the differences are in the microbiome and how this dysbiosis comes about because of the kidney disease.
So, the kidney is supposed to eliminate toxins. When that's not happening adequately, those toxins back up,
Mhm.
often will affect the gut. So things that we expect to get rid of tend to have nasty personalities. And so the actual composition of the gut microbes changes from friendly to unfriendly. And there's some known uremic toxins. They call this uremic toxins, as in uremia is getting a little bit broader definition. And so things like are things that in a diet would be fine for somebody else ends up not breaking down properly. And then you have irritation, inflammation. There's actually damage to the way the gut cells hold together.
Mhm.
And so, you end up with leaky gut because these
Mhm.
uremic toxins that are floating through the bowel can jump through the colon and actually cause inflammation that will end up hurting kidney. And then you're in this vicious cycle. The
Yeah.
kidney's bad, and that leads to cardiovascular stuff
Mhm.
because
Mhm.
the
Mhm.
vascular, the kidney's a clump of blood vessels.
Mhm.
And so, ultimately what we don't want is scarring,
Mhm.
fibrosis. And
That's the
so
end stage. Just kind of like what
it's
happens in
amazing.
every organ, right? Yeah.
Exactly.
Yeah.
I mean,
So
and in kidney, it ends up, there's these gorgeous little nephrons. Here's the slits, things.
Mhm.
It's like this things can't get through. It starts getting leaky. You can have leaky kidney too.
Mhm.
But I
Mhm.
read something earlier today that kidney decline affects absolutely the entire GI tract. It affects the stomach in terms
Mhm.
of gastroparesis, slower processing. It
Wow.
affects the way the small intestine has fluid after you
Yeah.
eat so that
Yeah.
things are processed.
You don't
It
have the
affects,
digestive juices being formed.
and there's changes in
Ye-
transporters that are
Yes.
unique in kidney disease. The large intestine, just things get all confused, mixed up, inflamed. I just wanted to backtrack. Uric acid and parathyroid hormone and vitamin D are also very essential labs to know about and have,
Yeah.
because there's cycles where one of these things goes wrong and then everything else starts plummeting.
So we talked about GFR. We talked about, of course, the electrolytes. We talked about phosphorus, very important,
Yeah.
calcium, vitamin D, uric acid, and then doing a more detailed cardiovascular inflammatory panel, right? Which
Absolutely.
looks at the
Advanced
Mayo,
lipids.
advanced lipids. So yeah, that's that. And of course, insulin, looking at insulin
Really.
regulation and how that's working. Very important. These toxins that accumulate from a low functioning kidney
Yeah.
accumulate everywhere, but predominantly it sounds like accumulate in the gut and cause this distress in the gut with the leaky gut, the change in the microbiome, these opportunistic
Exactly.
bacteria that don't serve the gut well cause a lot of translocation, like movement in that
Exactly. I
barrier.
mean, the endotoxins start
Endotoxins are
forming.
going through, antigens are going through. One of the biggest culprits I read in your book was definitely gluten as one that will stimulate, right? So
Yeah.
when it comes to, and then of course a lot of our patients with chronic kidney disease, I mean more advanced, we tell them minimize certain vegetables, minimize certain foods, right? They're usually not getting because of the potassium, because of this, don't eat bananas because of potassium. And so they're usually not getting as many plant-based foods as someone would. They're usually not getting as much fiber. Talk about that a little bit about the recommendations that nephrologists give to our patients with to people with chronic kidney disease. Like I'm sure there's some. Uh,
Not everybody has an elevated potassium.
that's
These
true.
days, they're actually changing that narrative and saying, "Don't
Okay.
worry, just eat the foods. We'll
Eat
give you a
whatever.
drug for the high potassium." I still am like, know what your potassium is. Here's the trick with high potassium: alkaline.
Tell us a bit about the
I saw
diet. Tell
so
us
many.
about the
I,
alkaline diet.
I saw so many people before I found out. I mean, I think God gave me a bottle of bicarbonate tablets from the thrift store here. It's brand new, and I was like, thank you. I
Yeah.
found uric acid normalized, PTH normalized, phosphorus normalized, and potassium normalized, and I felt so
Wow.
much better. I mean, and I was eating a plant-based diet. In fact, with the diet, decreasing protein, it helps. That doesn't
Okay.
mean for some people, they really need to way back down on protein, at which point,
Okay.
and you can
Animal protein, decreasing
really
animal
any
protein.
protein, all
Any
proteins.
protein. Okay.
So for the geeks who are listening, zero point 0.8 grams of protein per kilogram of optimal body weight. Nowadays we're telling people, oh, 1.5 to 2 grams per kilo,
Mhm,
too much for
mhm.
kidneys.
Yeah.
And there's various reasons. Some of it has to do with TMAO,
Mhm,
in
mhm.
too much protein. And so
Yeah.
that right there, how do you know? I advise people to use chronometer.com because you
Okay.
don't know. You really don't
You can
know. I mean, I
track.
think
You can
everybody
track
should do
so much.
this.
I use that quite a
You
lot.
don't know.
You can
How much
track. Yeah.
potassium am I getting? How much phosphorus am I getting? If you're motivated, you get better. And so I don't think everybody has to back off, but each case is unique. Eat to your labs is the
Eat to your last. I get
so
it.
if your
Of
labs
course,
say,
depending on the cause, right? If your insulin is off and there's a lot more, right, resistance there and the glucose metabolism is off, that's different. You'll have to adapt
exactly.
that way,
And you got
right?
to
So yeah,
adapt your carbohydrates. Now, the thing to know with kidney is we're at way bigger risk with kidney disease than, quote, the normal population. So, way more risk for becoming a diabetic, way more risk for cardiovascular, 30 to 100 times more likely to have a cardiovascular event.
hmm
I mean, that's like, whoa, okay, what do I have to do? And there's a lot to do. I mean, my book talks about bioregulator peptides, which I
Mhm.
found
Well,
remarkable.
let's no,
But
there's you
way
have to do a
before
part
that,
two. Dr. Rose, we got to do a part two. There's so much information.
I
You have
know.
so much to share, and I don't want the community to miss out, right?
Oh,
So, if a good resource for alkaline diet, what would you recommend? Is it a good quality, something that you would trust for patients if they want to look into this?
I think it's utterly safe to use bicarbonate.
Okay.
You can do a half teaspoon of baking soda, that's bicarb, in a half a
Mhm.
cup of water on an empty stomach because it does interfere with stomach acid, which is not a
Yeah.
bad thing. It's actually
Yeah.
life saving. We don't want to block it. And there's also citrate.
Okay.
There's a lot of people who recommend potassium citrate. I'm a little more cautious because with kidney, maybe you don't need to add more. And if you do,
Potassium.
then that works. I use magnesium citrate. I have it
Okay.
in a bottle near where I cook. I just
Okay.
sprinkle it in cooking. I know the amount at this point. There are ways, and a more vegetable based diet,
Hmm.
vegetable protein takes some learning, but you can eliminate eating red meat very easily. You can include some animal foods if that's your tradition, but you don't have to have it all the time. You don't
Right.
need it every day, three meals a day. It's
Okay.
too much protein, and there's issues with the way the body metabolizes. It's just acidic, and when things are
Yes.
acidic, everything gets all derailed.
Absolutely. Okay. What about fruits? In terms of fruits and vegetables, any limitations at all?
I think so. I mean, fructose. I used
Mm-hmm.
to tell people, "Oh, no problem, it's fructose."
Right.
Now we know fructose is inflammatory. It messes up your liver. It's actually raises your uric acid, which is challenged already in CKD. And so I read something where like 15 to 25, is it milligrams? Now I'm going to embarrass myself. It's
It's
one
okay.
piece of fruit a day. And
Okay.
so,
In terms
here
of
I live
fructose,
in
fructose
fruit
content.
heaven.
Yeah.
I have to be careful. I mean, you could just guzzle, I mean, and it's like I had to learn how to eat with moderation.
Uh-huh.
You don't have to eat a whole banana. I grow bananas. We beg people to take them because we have too many. And yet, at first I had a high potassium. I didn't eat any. I got
Mm-hmm.
past it. Now I eat a little, and so this is a long haul issue. You can
Mm-hmm.
do some dramatic stuff. I mean, intermittent fasting is nice. It
Mm-hmm.
gives the gut a little bit of a rest and you can do some healing. The
Okay.
diet, I think being organic matters. In my book, I
Of
have a
course.
chapter on glyphosate that is
Yeah.
very harmful for kidney.
Yeah.
Yeah, and the other thing is you can't really trust eating out. I
Right.
hardly ever eat out. When I go to potlucks, I bring what I'm going to eat. I'm that strict. That means self love, self willingness, willing to do this because,
Yeah.
and the other thing is not seeing it as punishment. The joy of cooking, it's a real thing. I'm giving myself a gift by eating well.
And also sharing this gift with others, right? It's this community, way of
Right.
showing love and appreciation and sharing. So we talked about bicarb. We talked about, of course, all of this for alkaline diets. We talked about citrate, max citrate being preferred to potassium citrate. Of course, everyone watching, please, you must do this under a healthcare professional's
Exactly.
advice, right? You must work with someone who is very familiar, who understands and knows what they're doing. I will say
Yeah.
that very often when you go ask your kidney doctor about this, they may not have the information. Some may, but what you want to make sure is you're not doing anything that harms you, right?
Yeah.
That
Know
hurts you.
your
Please
labs.
and
From
know
the,
your labs, exactly. Know your data.
the other thing that I
Yeah.
found incredibly useful way early on in my explorations was Acacia Senegal.
Acacia should help restore those short chain
It's
fatty acids,
amazing. I mean,
right?
I spoke with nephrologists from like Oman.
Okay.
Oh, we get our patients off of dialysis with this. I was like, I want some.
Wow.
And of course, everything I ever put in my mouth, I spent a month researching before I did it.
Right.
And
Right.
it's a prebiotic. That
Yeah.
we know, which is an amazing thing. It actually enhances butyrate, which is
Right.
food that our body makes to feed our gut cells. And
Right.
so, and it swabs up toxins in the bowel so you excrete
Absolutely.
them.
Absolutely.
Yeah.
It very
And
important in reducing inflammation and preventing cancer. I think that's how we think if you don't have enough butyrate, it leads to all of that. So prebiotics, and I think in everything, if you can go as natural as possible without necessarily having to take too many
exactly.
supplements. If you can go as natural as possible, that's really,
And this
really
stuff, this is in a bottle. I have it in a paper
yeah,
bottle.
yeah.
It's in my tea. I don't even know it's in there. So my
Yeah.
recommendation is a teaspoon a day. The maximum is 5 teaspoons a day, but if you don't hydrate well, you get cement in the gut. So,
Okay.
hydration with kidney
Rehydration is
is
key.
you
For
have
any
to exercise,
fiber.
you have to sleep, you have to start
Absolutely.
looking at everything toxic that you think you have, get rid of it.
Get
I
rid
mean,
of
it
it.
really
So
is a decision.
I mean, I think organic, organic, organic. I don't think we can say that enough. There's a lot of studies coming out in gastroenterology about the impact of toxins like glyphosate and PFAS and air pollutants and Crohn's disease and liver disease. And it only makes sense, right? That, the liver is one of the major detox organs, and so is the
Exactly.
kidney, right? So it
Exactly.
only makes sense that the kidney is definitely going to be heavily impacted because that's where a lot of these toxins kind of dwell and reside. And if there's issue, that in itself can cause malfunctioning or lower functioning of the kidney. Are there any studies? I think there are. You've
Yeah.
talked about
Oh,
for many years, but we don't talk about them.
enormous amount of, I mean, there's so much
Love
stuff. I mean, she's brilliant, MIT brilliant. And she wrote a book, Toxic Legacy, that is so worth reading. I mean, it's
it.
just like you go, oh my God, I've been eating out too much. you know, I mean, it's really hard, especially where
Yeah,
I live. You don't eat out here. I don't, but sleep is another thing.
yeah,
A little sidebar, but I'm a night owl. I had to change that. There's just so many things, and in the conversation with you, because of the gastroenterologist, they all cycle back to this
right,
critical relationship between what we eat, how we deal with it, and
yeah,
then how it communicates with the kidney. And then you mess up kidney from the gut, and then it's talking to your brain. I mean,
yeah. That
eyes,
kidney brain connection.
thyroid, everything.
Absolutely. So it
And
all boils down to the gut once again, right? It really, really does boil down to the gut. We are going to end there. I'd love for you to show the book one more time. And where can we purchase this book?
the book
Where
is
is it?
exclusively being sold on Renology is kidneysuccess.com,
Okay, so
which
that's
is
what we're going to
my
post
website.
on the
And by
website.
the way, as I said, I'm putting information on that's available to anybody. There's some,
Free information, free resources.
but I've put a couple of things on, and as I get excited, I can start.
More.
There's a way to communicate with me. The book is not it's not watered down. And if
There's a
for those
ton
who
there. I
need
know.
some
She wrote
way just in.
I've read a couple of chapters that you've shared with me, and I'm like, oh my gosh, there's just so much information here, so much
So much.
wonderful
So
knowledge.
I mean, I'm looking stuff up every day.
Yeah,
And today I reread what I sent you. And it's like,
yeah.
wow, it's good. I don't, I can't remember 800 pages of
There's so
details.
much, a wealth of
It's
information. But I'm so glad that you're doing this. And I think it's so important. It would be such a shame for you not to put this down on paper, right? And not to share it.
yeah.
And then not be here one day and we're like, whoa, all that information, all that knowledge that Dr. Robin Rose had, like so I'm so glad.
Oh,
I mean,
you.
writing stuff on paper and keeping this for us as a legacy for those who come after us and those who will come after and after. That is
Yeah.
what I think is really going to change the way we practice medicine today and making sure that we are doing everything we in our power to take care of our patients in a very holistic way and not just treating disease but really prevention, which is the focus, right? Especially in early kidney disease is
Treating
prevention is
success.
yeah, it is the key to
Treat-
success.
I know, I
You know,
love it. I mean, I started all of this in the 70s.
so
So
many
to
years.
see a half century later, it's a half century later. I'm like, oh my God. It, and we've evolved so much. Some of what was absolutely crazy back then is mainstream now. And so we
It
keep
is.
going and
Keep
things
going.
get accepted. I'm hopeful that our new HHS director brings things like peptides
I
and
mean, it would be
food.
amazing. Yeah. I mean, if he can tackle a lot of the things on a policy level, like the toxins, huge seed oils, the way I hear we're just, you know, some industries, I mean, don't eat processed food at the end of the day.
Any
I
processed food, that's absolutely
don't think
100%.
just because Steak and Shake is taking seed oils and replacing it with something else doesn't necessarily mean you got replacing it with beef tallow doesn't mean you need to go eat over there. You know,
Yeah,
let's
because I
keep
mean, there's the chemicals still.
the chemicals are still in these are not necessarily organic, grass-fed, pasture
And you
raised.
know, one thing I wanted to say is the thing to know about is kidney tubules. They're
Hmm.
almost similar to the small intestine.
Yeah,
They
yeah,
decide things. And so
yeah.
the first thing that gets messed up is kidney tubules.
The tubules,
We
yeah,
don't
yeah.
measure that. You don't even know that is happening. And so it's like in the
Unless when
mind's
it's
eye.
really severe, right,
Say,
Robin? When it's really severe, like acute tubular necrosis.
oh yeah, yeah. Well,
They're
you
actually
can't
destroyed and
get.
damaged, right? Yeah, that we can
This is
measure,
like
but
for the average Joanne and Joe walking down the street. It's
yeah,
like, how are your kidney tubules doing?
yeah,
I don't know, but
yeah,
you know, gee, I'm feeling a little tired. Okay, maybe I have too many toxins and my mitochondria aren't working. You know, it really does take working with somebody like you who
yeah,
has this kind of more full fat approach, you know, I
yeah.
mean, full fat in that way, but you know, if you
Yes,
don't mention
you get
nutrition at
it.
a medical visit, how are you exercising? Who hurt you? How are you stressed? The
Yeah,
antecedents, all of that stuff that we know from
very
functional
important.
medicine
Yeah,
has to be there. It's
has
not
to be a
optional.
part of it. Yeah, it's part of it. This was an amazing conversation. Absolutely enlightening. I think they are going to really eat this one up. We're going to post the website. Please send me the link for the website where we can also purchase the book. I'm a little bit intimidated by the book, I'll be honest with you.
Oh,
It's a lot. You remember that Harrison book we had in med school, internal medicine?
that's what I wanted. I said I want a book like Harrison's.
You
My
did it.
cover's
You did
prettier
it
though. Come
all
on.
on 50. Yeah,
You
no,
know,
this is an
it's
important
not
one.
a book you sit down like, you know, okay, I'm going to
Yeah.
read a book. I mean, the first section is very useful. They're modules. So each
Yes.
chapter is a
Yes.
standalone. So you're
Yes.
like, huh,
Exactly. I
what
like that.
about leaky
You
gut?
can go with
What
yeah, you
about
can go
phosphorus?
exactly. You could this is a great book to use as a tool really in practice for
Like,
us, right? It's a
what
book for you.
about a liver bioregulator? What are they actually? Oh,
Yeah.
okay.
It's in
And
there.
what was that?
Yeah.
You know, I keep looking stuff up. I
Yeah.
was totally radical. I didn't, that's why I wanted to self-publish. I don't
Yeah.
have paragraphs, I have bullet points. So it's easy. You can
And
go,
I love that when I was reading the leaky gut chapter, the kidney leaky gut, it was just so easy. You explain that you give the definitions, you explain what it is, and you keep going back to the pathophysiology, which I love, right? And then you bring back that into when you're talking about treatment options and management options, you bring back that pathophysiology. I love the bullet point. For someone like me, can't do paragraphs. So this was easy to just boom, boom,
yeah,
boom,
me
boom, boom.
too.
I
Because
love
I'll read something and then I put it into that. Like in a paper, it'll say, well, blah, 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 or it's affected. I make a list. Oh my
exactly.
God.
And that's it. This is great. So I'm very excited. Send us the
It's
link.
so
We'll
fun to
post it.
talk to you.
Always so fun to talk to you as well. And I can't wait for the next book, but we got to pace ourselves because there's so much information in Renology peptides that we got to share this information with the world, right? I thank you so much for gracing us with your time. And I'll see you soon. For everyone, have a wonderful
Thank
evening.
you.
Thank, thank
Aloha.
Aloha. Bye.